This
Coming.
conference will now be recorded.
Thank everybody for coming. I'm gonna give it a few more minutes because I know people are still coming in. Okay, we can kind of go ahead and start. So, hi everybody. My name is Tanya Till. I am the Health Equity Specialist with Tarrant County, and my focus area is health. And I also assist with housing. The person who assists me is Kylie, so she'll be paying attention to the chat. If you guys have any questions or anything, y'all can also drop it there. Just a little bit of housekeeping before we get started, because this is a very intimate setting and it's virtually. I would just ask that everybody turn on y'all cameras. Let me see beautiful faces. Um, and then, like I said before, any questions or concerns or anything, just go ahead and, put it in the chat. Um, that way, we can get everybody's, we can see everybody and hear everybody. So before we get started, I just want my team to introduce themselves, and then after the team, everybody here can kind of introduce y'all self, so everybody know who we're having a conversation with, and just say where your organization that you're with and things of that nature, anything that y'all want us to know about you before we dive into this discussion heavy presentation. All right, so I've introduced myself. I'm gonna go ahead and give it over to Kylie since she backs me, and then we'll go from there.
Thanks, Tanya. I'm really excited to be here today. My name is Kylie Brooks. I am the Health Committee Assistant to Tanya, but I'm also responsible for the Housing Committee and the Economic Development Committees as well. I'm really excited to see what we have in store today, both in this set of data and then also what you guys have experienced and some of the things that you're looking forward to as we work to improve health equity across Tarrant County.
I'll go ahead and go next. My name is Tanisha Stanford. I'm also a health equity specialist here. I'm responsible for the communication committee as well as the education committee, and I'm excited to be here. I know health is something that's very important to all of us, not only here in this chat, but definitely everyone here on our team. It's definitely a delicate spot for all of us, so I'm just excited to see, what we're all able to accomplish here.
And my name is Barbara Young. I'm a health equity specialist here with Tarrant County Public Health. I am working with internal policies here, and I'm happy to be here today to support my coworker, Tanya.
All right, thank you, team. And just for the members that are here, if you don't mind, could y'all introduce yourselves, please, in any order?
Hi, I'm Matt. I'm the Chief Transformation Officer for NextStar. We're the ambulance provider for the culture side of Tarrant County. Work a lot with the health department, so very honored to be part of this process.
Thank you. Nice to meet you.
My name is Anish Bhandari. I am part of the Public Department of Public Health. I'm part of the Ending the HIV Epidemic team here and work with the SOP beta surveillance outreach and prevention team. So thanks for having me aboard.
Thank you for being here too, Anish. Miss Linda, you want to go ahead and jump in? Oh,
Well, hello everyone. I'm Chichi Akpan. I'm the Minority Health Specialist. I'm actually sitting in for Dr. Wingate, the Health Equity Coordinator.
Hi, y'all. My name is Julia. I'm a public health associate, and I'm here just assisting the health equity team in any capacity they need me.
alrighty. I think Miss Linda was trying to introduce herself, but I don't know what's going on with her mic. Um, we can go
Good
ahead and.
afternoon. I'm sorry.
No, you're fine. Go ahead.
Okay. I'm Deanna Madrid. I'm with the Potter's House of Fort Worth. Just looking forward to see how we can partner and get this information out to the community.
Thank you for being here.
Good
All
afternoon. I'm
right.
Pierre Gant, the community outreach rep for Star Plus Samara Group. The same. Glad to be here. Hopefully, learn more, share, and help. Thank you.
Thank you. Okay, guys, I'm gonna go ahead and kind of get started. Thank you for y'all's introduction. Thank you for being here and giving me an hour of your day. Um, so we can go ahead and let's just talk about our purpose. I know some of you guys have been in other committee meetings, but our purpose is to pretty much reduce COVID-19 related health disparities, all in support of populations at high risk and underserved, including racial and ethnic populations and rural communities. These meetings, the health meeting will take place I believe I said it for every third Wednesday of the month. If that doesn't work, it's not set in stone. Just email me and let me know. And then also, just to let you guys know as well, these meetings are for everybody. So if you know somebody in some of these communities that we're serving, let them know that we're having them. Everybody's voice is important, needs to be heard. We can learn from people that are actually experiencing the things that we're going to discuss, or people that work closely with the people in these areas that we're trying to serve. Um, the other thing is, with health, the health committee, it is very heavy in discussion. We're going to be talking about COVID. We're going to be talking a little bit about mental health. So for some people, it can be a very touchy topic. Also, it can be very thought provoking. Please chime in and share if you had, experiences in any of these areas. Like I said, we're all here to learn and to see how, we can help one another, basically. Sorry. So that's just a little bit of the overview. We're going to go into medical mistrust, the COVID data, mental health, access to care, and then an open chat discussion for anybody who feels the need to share anything or inform us of anything. So going into uh, racial I'm sorry, medical mistrust, we talk about the racial differences. And throughout history, medical racism have often been based on like the myth that Black people are different or inferior uh, due to, different I guess, body features. One example was phrenology, which is the belief that was popular in like the 19th century, where they said that character traits of the skull and how the skull was shaped was an indication of how the character and mental abilities of a Black person. So, and of course, they say that slave owners thought that, Black people were naturally more submissive, and that was just how they justified their trade. Um, Now, when it comes to deception and like misinformation, Black people were used in the well, I think it was like the 20th century. One of the worst experiments, in my opinion, was the Tuskegee Experiment. So those who are not really familiar, you notice when the government researchers recruited, I think it was like 600 poor black men from Alabama for a syphilis study. And in the advertisement, it had free blood tests, free treatment, except there were 399 in a group who had syphilis, but they were never actually treated for it. And they was just observed until they died. And they didn't, inform them or their families that this is what they were actually doing. So the whole time they're thinking, I'm getting care, these people are caring for me, and the whole time that's not the case. Then we can talk about taken without consent. We have the example of Henrietta Lacks, who was the black woman who was diagnosed in a hospital for an aggressive form of cervical cancer. And she was killed by the disease, but they took her cells um, without her consent or her family knowledge, and they used them. They're studying them, and you know, didn't tell anybody. And I guess because they felt like she was, deceased, that they didn't have to get this consent. And matter of fact, I believe they're still being used today. Then we have the digital discrimination, and in the uh, 20th century history, one of the big trends in medicine globally has been the use of course, computers to manage healthcare. And in 2019, an algorithm that helped manage healthcare for 200 million people in the US, it was found to systematically discriminate against Black people. And according to the research published in the journal Science, people who self-identified as Black were giving lower risk scores by a computer than their white counterparts, leading to fewer referrals for medical care. The computer appeared to give fewer referrals to Black people because of the care costs on average were less over a year than those who were white patients, despite the Blacks being the sicker patients. So, so this is the COVID-19 positive cases, and as of January of this year, the infections rose again, of course, across all groups, and the spread of the Omicron variant resulting in the highest case rates recorded since the start of the pandemic. Rates were higher for all groups of color compared to whites, with Hispanics people having the highest infection during this surge. And as of January 8th of 2022, the infection rate among Hispanic people were more than twice as high than that of whites. So the surge was also the first time since the early pandemic that the infection rate for Asians and the Pacific Islander people were higher compared to the other groups. And as of February 2022, infection rates have fallen sharply and disparities once again narrowed. Um, but this reflects the overall decline in cases as well as some lags in the data reporting. So when we look at these COVID-19 positive cases, these are just the people, of course, who went in to get tested. So the numbers, I'm pretty sure, are higher than what we're actually seeing here on this graph. Let's move on. So our vaccination rates. You can see here on the vaccination rates that it's outlined by race and ethnicity, and of course they have the percentage. We had a vaccine that was developed, you guys, at a very fast speed. Matter of fact, it was faster than any other vaccine before it. And COVID-19 quickly became a political issue during 2020, the presidential election, with the spread of misinformation about the virus and its health implications. But there were many factors that led up to a quick development of the several COVID-19 vaccines, including significant government funding to help research teams move quickly, leaning on previous vaccine knowledge such as SARS. But either way, we still have issues with getting people vaccinated and, getting people to trust healthcare providers when it comes to vaccines. And of course, that goes back to the medical mistrust, because a lot of the times the the people who were not getting vaccinated were the African Americans. Okay, so now we go into a little bit of how COVID impacted mental health. You guys can take a look at the graph, and this is, of course, for adults, but it's COVID affected everybody. Um, Consistent with recent studies conducted during earlier stages of the pandemic, we found that having at least one COVID-19 risk and experiencing the coronavirus victimization was associated with higher mental health risk um, by perceived coronavirus induced increase in racial biases. So, this study also expands on the work of prior findings by identifying distress for the pandemic related uh, for like housing and employment disruption. So those people who lost their homes or their jobs, it definitely had a major effect on their mental health, causing people to drink more, to turn to substance outside of just drinking, so drugs. A lot of people did not like being isolated. People had to work from home, and a lot of people had said that working from home made them more depressed. So we have to look at those factors as well. Not only that, but being at home, I think at first people were thinking, hey, I get to work from home. I don't have to commute. But we don't know what the home environment looks like. So if you're at home all day and you're working all day, there's no break in between, and your work is there with you. So where's your peace at that point? Um, Also, students had to start going to school, from home. We had a lot of CPS cases to come up because parents are trying to figure out one, okay, my job, I'm getting less hours, or they completely lost their job during the pandemic. Then you have your kids that you're trying to help with their assignments on a computer. Some of these parents don't have internet access. We have to factor that in. And then trying to help their child, and they're already stressed out. A lot of parents were basically having breakdowns and on screen physically harming their kids. And, it was just a big deal. And then, of course, parents were making the argument that I'm not a teacher. I shouldn't have to be the one to teach my kids. But at the same time, you don't want to send your kids to the school, but then you don't want to teach them at home. It was just a really big thing when it came to mental health. And I personally don't think that there was enough light shed on the mental health part of it when it came to the pandemic. Um, so that's important that we really take that in consideration when we talk about this whole health as it relates to COVID. We have to look at every aspect of health, and mental health is a huge component of that. So we have 8 psychosocial stressors that impact health. I got this. We were doing a training with Bird Guest from Racial Equity Group, and this right here really stood out because, like I was mentioning before, it's more than just physical body that affects your health. So you have acute life events or events, be multiple things. A death of a loved one or job loss affects your health tremendously. A divorce or major illness affects your health. Employment, financial. If you don't have a job, which most people get their insurance through their job. If you don't have a job, now you're lacking health insurance and you have to figure out a way how to get that. Also, financial. So if my finances are not in order, my food, my transportation, those things also hinder and affect my health. Um, Daily racial biases, job discrimination, stress related, people spaz out. If you're stressed, it affects your body. People die from, having heart attacks and high blood pressure, like things that really alter your health. And we just looking at it on the surface level, but is so much more deeper than that. Relationships, it depends on, are you dealing with toxic relationships all the time? You have to pay attention to your body. Early life or childhood, that also makes impacts our health. Community, where we live, also is a huge factor because if I'm living somewhere where there is gang violence, the air is extremely polluted. If I stay next to some big factory, if I'm, I don't know, if I'm living somewhere basically where the quality of life, care, everything is not okay, then it affects my health one way or another. Even if I tend to say, oh, I'm a happy person, but I live in this neighborhood, my health is still being affected regardless. So, access to care. Um, when it comes to access to care, it's very, how can I say this? It's very important that people know and understand that access to care is not as easy as people like to try to put it. I worked at a hospital setting, and I kind of felt like a lot of the times um, the doctors wasn't as hands-on with their patients, depending on insurance. So even if I have insurance and I'm thinking, oh, because I'm insured, I'm good, some providers will look at the type of insurance you have, and that's the quality of care that you will receive. As I mentioned before, actually, I did a panel discussion with one of the doctors at TCU, and he, during the panel, basically told us that he had patients that would basically, they would need therapy, need it bad. It was like, when you come in for therapy, you're trying to prevent a crisis from happening in your life. So he told us that he had patients that would literally tell him it was either come get therapy or pay a bill. And some patients would literally make their bill or pay the bill late or miss out on something just to get the care. And then he started to see where patients were then quitting their job altogether because they were able to afford or receive better health care because the insurance through their employer was extremely high. So that's also something we have to look at. The amount of money that's coming out for insurance, and then we're expecting people to live off whatever that is that they're making. And healthcare is one of those things that is kind of tricky. You got insurance, but then what kind of insurance? I've also seen people in a mental health setting where the insurance was done paying for their stay, but they clearly and actively still needed the help. And the doctors or the providers would simply say, oh, they'll be fine because of the insurance and send them on their way. So when it comes to access to care, it's one of those things that, we have to be mindful of. And especially there's a shortage of healthcare providers in the lower income neighborhoods. They, you know, have a hospital that's close by, but the level of care is not the same as a hospital that's on the other side of town, basically. So they're mostly sitting and relying on emergency room visits or community-based providers for different things. But traveling outside of those immediate geographic areas may cause them to go without something just to get the better healthcare services. And this is just another slide. I didn't want to put them together on there because I wanted y'all to be able to really see what I was saying and the numbers on there. And of course, this is for Texans. And it's just astonishing if you look at that. They report difficulty affording health care other than their more than their other basic needs. And so looking at this, it just makes me wonder how many people are saying, do I want lights or do I want to go get my medicine? Like those are two essential things. Do I want water or do I want to get my medicine? Like that's just something, one of the things that we'll discuss later in our open discussion, I'm sure. But those are the type of things that we need to see how we can help people in these areas to be able to have better access to. So this is the time that we're going to basically go over a few questions actually and need participation. And I know a lot of people don't like to talk over, the whole virtual thing, but this is very important. When it comes to health, I can present data to y'all because health is so vast. But at the end of the day, we need to hear each other. I like to hear ideas. So, if you don't feel comfortable actually talking, please put something in the chat. But the only way I feel like we're going to get stuff off the shelf and really get to the people and really service the people like we need to is for us to actually have an open dialogue and share ideas and thoughts and feelings on these things. So, the first question is, what are the day-to-day health barriers in the communities that you guys serve or that you know of?
So I'll kick it off as
I'm
as
sorry.
as the EMS guy. What we see on a lot of 911 requests is two things that are really these confounders. One is lack of transportation. And honestly, people call 911 to get an ambulance ride to an ER because they don't have any other transportation. And a lot of the calls that we respond to are just low acuity. We had a case just recently where we were called out to a address on Lancaster. When we pulled up, the city bus was there and we couldn't find a patient. This woman leaned out the window of the city bus and said, "Oh, you can, never mind. I wasn't sure if I had missed the bus or not." Like,
Oh,
seriously. And then the second big issue is behavioral health. And there's literally such a dearth of behavioral health resources, 20, 25 calls a day to 911 or behavioral health patients. And there's just nowhere other than a hospital emergency room that we can bring these people for behavioral health support.
absolutely. And when it comes to behavior health, I have a little bit of background there. And that area, again, a lot of people don't understand mental behavior health, especially police officers. And I believe that there needs to be more training done on that because for officers, because a lot of times, like I've mentioned to tons of people, officers don't or aren't able to tell the difference from somebody who is actually committing a crime versus somebody who is having a mental breakdown. So when we have those type of things going on, um, they don't know how to assess the situation, and that's dangerous because people lose their lives. This person is clearly having a mental breakdown, and you think they're trying to attack you or hurt you, but it's not that. It's them not on their medication. So what happened? They maybe, like you said, Matt, they couldn't get to their appointment. Transportation. It's just one of those things. So that is, again, transportation affects our health. So thank you for that. Thank you for sharing. Anish, were you going to say something? I'm sorry.
Yeah,
No, you're out.
yeah, thank you. Yeah, thanks for getting back with me. So, one of the major things I see is just lack of access to health. Like, I know JPS has their connection, like JPS connections to help individuals out that don't have insurance, but that process alone is kind of tedious and long. And one of the things that I want to, like, as my role as the EEG care coordinator, is try to establish a relationship with the JPS connections, network, the eligibility specialists and all that stuff, to just kind of like help people get through that so they can get health coverage. And another thing that, yeah, just lack of insurance and all that stuff, that's just a big barrier, because when people are sick or people need to go where to go, they don't know where to go. And what the problem is like the problem is going to get worse. So it's just scary to me that, there's people are still having delays in access of getting health coverage where there is provided, but it's kind of hard to get.
Thank you. I agree with that again because that's kind of piggybacking on what Matt was saying. Access to healthcare is just one of those things that we just really need to show some type of improvement. I was talking to the doctors on the panel and they were saying that It's an insurance thing, and of course, it's a company thing. And how do you get the two to change your policies and to make it more affordable? That has yet been determined. But clearly, enough people are saying that this is a situation that needs to be addressed. So hopefully in the near future, I'm very hopeful that something could be changed and done about that. So what are some techniques that can be used to gain the community's trust? What do y'all think? I know for the Black community, and just from experience alone, the Black community, when it comes to medical, simply does not trust doctors. Um, won't even go regularly to doctor's appointments. It'll be a situation where somebody got to have a heart attack and say, "Oh, I almost died," and then they'll start going to checkups and getting medication. Um, it's just one of those things. I had an uncle who went in. He tested positive for COVID, and he said that they were about to put him on a ventilator. He unplugged himself and walked out because he felt like they were going to kill him. It's just one of those things. And I was like, well, you needed a ventilator, but he left and he's still here and he got better. So he said he told them he didn't feel like he needed a ventilator, but it just, the mistrust in that. So, and then you have the stuff that's on social media, like for example, Serena Williams, who when she had her daughter, she almost died, and she was telling them that she wasn't feeling well after giving birth, and they completely, ignored her. And it wasn't until she advocated hard for herself that something was done. So, how can we get, what are some techniques that we can do to get people to trust the providers, and I guess that's the two-sided questions. What can the providers do, to gain trust?
I know it's for
I
me, when my experiences going with doctors and stuff, I found that when I go to doctors who look like me, they kind of hear what I have to say. I'm often dismissed by doctors who don't look like me. They don't take what I have to say seriously. They kind of like just give me a band-aid, pat me on the back, and say, "Go on about your merry little way." But I think a more heavy presence of a representation of the underserved should, um, I guess, be in the forefront of a lot of providers that will kind of like strengthen the trust between healthcare and the residents. And just being, even if you are a part of the opposite population, just putting yourself in a place of empathy and just kind of like listening and really trying to get understanding of where the people you're serving are coming from and how they're feeling, and just really using that as an angle when you go in to treat them. I think that's a good place to start.
Hey, this is
Sorry.
Julia. Oh,
Go
a
ahead. I'm
minority.
sorry.
I just kind of wanted to give an example of how one out-of-state county tried to gain the community's trust. Um, there's actually a couple. One was they partnered with barbershops, since they are a very central part of the Black community. They partnered with barbershops and used the barbers as more like community health ambassadors. And they were actually, they had their own forums. They partnered with a barber school as well. And they had a physician who was affiliated both with the health department and the state health department. So they used Black public health leaders. The physician was a Black physician, and they held what they called shop talks to educate the barbers about, it was for COVID and COVID vaccination, to try and spread information with the patrons. So they kind of used them as, community health ambassadors, and that showed improvement.
Thank you for that. And I totally agree. So I'm sorry, I was looking at the chat, and Miss Linda, she was saying that something is going on with her mic. However, she did wanted to chime in, and she said, "My community corps team continues to say that people just do not trust authorities, whether it's elected officials, health authorities, providers, etc., when it comes to health information. So, not trusting the information that is being pushed out through an array of channel is a barrier." And I have to agree. When it comes to authority, people simply do not trust them. And then, of course, the misinformation through social media and all of that ties in together. So, Miss Linda, I definitely agree that those are some huge barriers. So, thank you for that. And when it comes to trust, she says you have to get the people from the community to being the messengers and the point behind our community. Uh, we can talk to people in the community, but what I've heard from the 76104 area is that, a lot of people come through the community and talk, but what's actually being done? And they're tired of talking to people. So it's just one of those things where we have to be creative in how we, move with them, because again, I believe they need to see more people to look like them, and they also need to see more action, because talking only does so much. But those are some really good points. Thank you.
I have a quick one to add to that.
Uh-huh.
In the past at UNC, there was a training on health inequities, and different people from the community would attend. And some of the things that I learned or start from, I'm not a clinician, but clinicians with the teach back method, getting interns to go back into the community to learn diverse populations that they otherwise wouldn't come in contact with. I mean, having the resource fairs in that zip code, there's one coming up at the end of the month, and we're begging and pleading to get the community to come out to that resource fair. And if we had other physicians at the hospital, or even the person that works the bills to explain, because sometimes it's not the fear of the clinician, it's the fear of the bill. You might not want to call 911. I might take an aspirin because you know that Matt, your team does a great job, but it's not going to cost some people 200. It's going to cost them 500. And just understanding insurance better, or the lack of insurance, with which resources are available. And that trust is built up over a time period. So it's nothing that someone just come out, guess what, I trust you. Either you trust me or you don't. But then you have to identify the reasons of why the distrust is there. And I can speak on myself as being a Black male and my family. There's not the fear of a doctor, because I'm an advocate, or I was an advocate for my parents, and I never let them know what I do for a living, and how the language style of speaking is completely different. And when I did step in, most of the time they would ask, are you a doctor, or do you work in a medical field or insurance? Because I didn't allow that conversation to go at a pace that was unnecessary. And I think you understand what I'm speaking about.
Right, right. Yes, thank you for sharing that. And you're right, trust is not going to happen in a month, 2 months, a year. It's going to take some time, because it didn't just, it was years of, them or people doing things to, not be trustworthy. So, yes, it's definitely something. Trust is so easy to get at first, but it's so hard to get back. So, I definitely agree with you on that. All right. The next question up here I have, are there any good or bad policies impacting health in your organizations or any organizations that you may know of? So have y'all seen any type of policies where you thought, that's good, or oh no, that needs to be revised as it relates to health?
I got another one on that. We had an opportunity, and this is not meant politically. I'm just trying to speak, and it may not come out right in an open
Mm,
forum, but there's an opportunity to provide healthcare coverage for everyone. It could be changes made to it, and some people oppose. If you don't have insurance, typically you may not get small things treated quickly, and they grow into larger things, and chronic conditions uncontrolled, the bill's going to go, and we're all going to pay for it anyway. And I just don't understand that portion. Or even, in the Medicaid system, it's available, but if any one of us on this call right now lose our job, we probably will never qualify for Medicaid because of the resources. So we'll be searching for a medical home, until we find a job, because we wouldn't be able to cover Cobra. So The bad policy is the affordable insurance that's available, or having insurance available to all, or access to care, or something that, that's not to me a good policy.
Okay.
Pierre, you make a really good point. We are blessed right now. We have a paramedic student from Switzerland who is here on a 2-week internship. And in Switzerland, insurance is compulsory. Health insurance is compulsory. And if you can't afford it, the government essentially fronts you the money, but you eventually, they do some true up, whatever. But she said the types of emergency medical calls that they have in Bern, Switzerland are totally different than what she is seeing here, because there's no uninsured people in Bern, Switzerland, and they have access to care. And she said she can't believe what people call 911 for here in this country.
I'd like to.
Go ahead. I'm sorry.
I was going to say, I used to work for a municipality, and I worked pretty closely with the fire department on a few things, and some of the stories that they would share about reasons why 911 was called are crazy, including, my plumbing broke, can you come fix it? And all of these people are civil servants, and so they do what they can to, fix the problem, but oftentimes the resources that we do have for people who are really sick and really needing the extra level of care, I think there's an additional level of education that would be really helpful so that they could do their job properly and people could still trust the right parties, but be connected with the people who could truly serve them in whatever non-medical need they have in that moment.
Thank you for sharing, Kylie. That information is very good. I wasn't aware of some stuff that Mr. Gant mentioned, so thank you for that. I learned something new. What changes have you seen in healthcare, which is negative or positive? Not policies, but just in healthcare in general. Like, have y'all seen any changes in anything regarding to health?
Making the insurance companies more earnest with outcomes. So to reduce hospital admission rates to reach a certain level of care is quality checks and balances for most of the federal or state funded programs. It's just not checking a doctor and walk out. Insurance companies are pushing mental health lines and 24-hour nurse lines and supportive services like service coordination. I think that's the major positive effect that's going to hopefully help save lives and generations, education and stuff like that.
And I would concur and add that for all the bad things that happened from the public health emergency, there were some really good things that happened, specifically with regard to the CMS waivers that were initiated that honestly should have been policy 10 years ago or longer, such as the flexible use, and Pierre mentioned it, of telehealth. We started doing a telehealth program at the beginning of the pandemic on 911 calls to prevent patients from needing to go to the emergency room with low acuity medical complaints, because we wanted to preserve the healthcare capacity. And holy crap, we did it a lot for these low acuity cases. And when we surveyed the patients, they gave the program stellar reviews, because we had EMTs and paramedics who were now actually suggesting to people that they not go to the hospital, and let's get a little doc in a box on the screen here and get you your prescription refilled, get you, whatever it was, get you a referral to somewhere else. So that was very positive. And we're still doing that today because it's still allowed under one of the waivers. The challenge, I think, especially for the population that I think we're referring to, was a change in the economic model for the federally qualified health center, the Northside Clinic. And we partnered with the Northside Clinic on a lot of patients. because their economic model from the federal government was such that they could afford to treat uninsured population and the Medicaid population. Well, their economic model changed 2 years ago to the extent that we now cannot bring them patients. We cannot refer patients to them because they're working with a whole different type of patient population now just to be able to stay open. And that is a big challenge and a bad change that's occurred over the last couple of years.
You guys hear me?
It looks like Tanya's mic is having a little bit of trouble, so I'm going to go ahead and introduce this next question real quick while she switches her input. What is the highest priority focus area to you guys in health and healthcare?
Prescription costs, co-payments, deductibles. I mean, again, we take those who are on the panel, those who are on the call. If we all have an incident that occurs, you have to pay that deductible. I mean, a lot of people, you miss out on rehab because you can't go back, you can't afford the recurring cost. So that's the cost of Medicare in general. I guess that's the highest priority, the medical cost.
Can y'all hear me? Okay. Um, yes, insurance. I'm hearing a lot about insurance. Like even like when I sat down with the doctors, the cost is a huge factor. Um, so is there anybody else that think that outside of the cost is another factor, or area we should focus on primarily?
I would say mental health. I mean, always mental health, just like you mentioned earlier. Um, sometimes police officers don't know how to recognize the difference between someone having, some type of emotional behavior episode or them actually committing a crime. And then also just getting various mental health resources out to the community so that individuals know how to recognize certain symptoms or behaviors themselves on an individual level, as well as on a community level.
Thank you, Tanisha. I definitely agree with the mental health. I feel like mental health is one of those things. If I'm not mentally stable, how can I have a job if I want to work? And how can I succeed in that role that I'm trying to work if mentally I'm not all the way there? And it can then snowball because then if I'm feeling depressed, I'm calling in. I could potentially lose the job. Now I don't have insurance. Now I have to go try to apply for some type of insurance outside of the job. And it just goes on and on. It's just one of those things. And then, not having a job affects your environment. It affects your food now. It affects your transportation. It goes on and on. So before anything, I feel like a person needs to make sure that self is good. So we can definitely go into somewhere and get other services. So definitely for me, I think it will be mental health as well. But right there is the cost of insurance. Anybody else? Linda.
Tanya, I have one thing to add. Pierre had mentioned the cost of prescription drugs, and that's something that we had heard from one of the former ER physicians at Cook Children's. He was talking about how, like, physicians often write whatever prescription is quickest and easiest for them, but oftentimes those prescriptions can be at a really high cost to the family. And he gave a specific example of one drug that physicians commonly prescribe to their child patients or pediatric patients, and it over the counter is like $200. But if they prescribe the same medication in a pill form and instructs mom on how to crush up the pill, put it in some applesauce, it comes out to be like $4 that way. So I think there's also an opportunity for physician or clinician education in this as well, and taking into account whatever factors are going on in their patients' lives outside of that hospital setting.
Definitely agree with that. And you're absolutely right. The cost could be something as small as instruction. You know, that's huge. So I can save all this money if the doctor says, "Hey, this is how you can prescribe. I mean, this is how you can take this medicine," and I can get in a lesser form.
One more to add on to that.
Hmm.
That's combining. I'm not a clinician as well, so I had that happen to me, and they combined the two medications, the nasal spray. One by itself was $173. The other, Flonase and something else, was $34. So I guess it's asking the pharmacist or asking the physician if you encouraging and educating those when you get the prescription and you see it that cost at the pharmacist to contact your insurance company if that's the situation, and ask which tier medication is below that cost that will do the same thing, because a lot of times many of the physicians, if that farm tech that came in and sold that prescription and they did the research or whatever the case, they write that prescription out. They get accustomed to it, not knowing that there are other cost-effective things. The provider doesn't know your insurance costs, so they don't have a dog in the race. It's us that lose out on the other end paying the bill. So be an advocate for yourself.
Right. I agree to that. I'm just looking at the chat. Miss Linda, I'm not ignoring you, I promise. She was just stating that they're continuing to do a lot of work around increasing access to healthier foods. And I think that is huge, because a lot of people in underserved neighborhoods, areas, they don't even understand how much healthier food options benefit their health. And then, of course, it's just so much more expensive. And, where do you get to these foods as well? So thank you for that, Miss Linda. Next question is, what mental health services did your organization provide during COVID? Um, this just, again, I'm a big advocate for mental health. I've seen a lot. Um, People have lost family members during the pandemic. They just couldn't take it. I've seen um, teachers, professors, like, you know, who deal with a lot of people in a setting where they deal with a lot of people, have mental breakdowns and did not want to carry on life in this way dealing with this pandemic. So um, I know at a previous role, they did the whole mindfulness thing, and also you were able to get like a mental health day. So I was just curious and interested to know, if where y'all are working or in previous roles, what mental health services did you guys get or do your organization provide? Nothing? Nobody?
Hey, I didn't want
I
to keep
can, I
talking.
can. Now I was
I'll
about
talk
to say.
afterwards.
Oh, oh.
uh, the EAP, Employee Assistance Program,
Mhm.
free counseling, the mental health, work-life balance was becoming a main focal point of expressing yourself and taking days off and taking care of yourself, But most companies have what's the EAP. Don't ask your manager, just Google it or look it up in HR. Your human resource departments will have it. I'm sorry, go
So
ahead, the next person.
I was just going to say the EAP, how easy was it for you to find it? Was it pretty simple or did you
Yeah,
have to ask around?
it was easy for me to find. It was
Okay.
even suggested. I went to our company's website and looked it up. In most cases, some companies have the employee portals that you use. I was dealing with grief, so there was grief things. They sent us stuff on making our wills. I mean, absolutely free. They even did a programming for us as employees to talk about that. So if anyone's in position right now to just try to encourage management, because people are still dealing with stresses, hey, let's see if we can get someone from HR come out or whomever to talk about that employee assistance program.
Well, that's actually really good because usually when it comes to the EAP, I hear people say, I knew nothing about it. Nobody told me anything. It's hard to find. I got to go through so many hoops to get to it. So I'm glad that your company has you have a positive feedback from that. Anybody else? No mental health services? Okay. And then my last question is, what do you want to see from us to make some of these changes? What do y'all, as far as this committee with Tarrant County, what would y'all like to see from us? Like, how do y'all want us to move about when making some of these changes? Or what changes do y'all want us to try to focus on and work on as it relates to health? Nothing?
I got something. I don't know if I'm going to go left field, but I'm just going to give it a shot. I mean,
Okay.
so just like I said before, just partnerships with other entities, just collaborations of how we can become affiliates with different providers, especially hospitals, to hook up our community up with services that they need, just with their needs and all that. I mean, that's one thing I really would love to see, is just better opportunities for collaboration so we can help each other out, and maybe we can help things out with what, if a hospital is having issues with a patient and they need some services, we can help just like trade off services and all that. I mean, that's something I would love to see, and we might already have that, but it's just like our entity is so huge, like I probably just don't know where to go. So sorry if I sound ignorant.
Oh, no, not at all. Thank you for that. Anybody else? Okay, so I know health is, like I said before, is one of those vast subject matters. When it comes to health, we can go from left to right. And I mean, it's just one of those areas where, yes, we could talk about mental health. We can talk about the uh, I don't know. It can be just the chronic health conditions. It could be mental health. It can be obesity. It's a ton of things, COVID, that we can, pinpoint and hit on. And my goal is to really focus on the primary areas that I think are not being discussed or addressed as much as they should. And of course, having a mindset of boots on the ground, getting into the communities, having people in the community that, they are able to trust, that look like them, that they believe, that are really there to help them, and collaborating, like you said, Anish, with others in order to get this done. I know, Deanna, you're with the church. She left. Where'd she go? Deanna's with oh, there she goes. She's
No, I'm
with
here.
Okay. I know with the church, like, what do y'all see? Do y'all have a lot of people coming in that are needing health services and things like that? Because I know a church is a big platform.
So I'm new. I've only been there a month, but
Hmm.
in that short time, I've seen where there's a lot of people looking to the church again for help, and we've had several mental health crises there at the church where we've had to either just spend some time with them or refer them out. And I think it's becoming, I guess, a good situation where people are seeking that help from the church. But then again, as a church, I believe we need to be knowledgeable in what's available out in the community, because, of course, there is a difference in spiritual and mental health, and how you feel about everything when you're coming to a church, and what you're looking for is kind of hard. I do the community outreach, so right now we're trying to get a mental health awareness week going at the church. And for that, it's kind of hard because, people have different ways of viewing things when they're at the church versus just out in the community in general. So some providers, I'm having a hard time getting providers out on a Wednesday because it's church related. Do you understand? So, I
Right.
mean, it's like we're wanting to help the community, but yet there's still that disconnect with services because we can reach a larger population if it is, say, Bible study or Sunday service, and most providers just do Monday through Friday. So our events on Saturday are well attended. So just getting the information out to me is going to be huge.
All right, thank you. And that's what I was, trying to reiterate is like the mental health thing is huge. People are needing it, especially in the Black communities. People are becoming more aware of it, and it's that stigma is still there, but they are more aware, like, hey, there's something going on here. So thank you for that. All righty, everybody. So it's 3. Um, and I just want to say thank everybody for coming and sharing y'all's thoughts. I will make sure that I put those things down and really look into everything that everybody had to say. Again, these meetings are every third Wednesday. So our next discussion, I plan on having some type of draft of how, we can uh, target these areas, especially with the church, with mental health, because it sounds like y'all really need help in that area. Again, also looking at policies as it relates to um, cost as far as insurance. Mr. Gant gave a lot of information on that. So I'm definitely going to look into this. I'm going to do my homework. And Anish, thank you for all your feedback. I'm going to definitely be thinking about trying to partner up, talking to some people at JPS, just seeing their thoughts and views on a lot of things as well. So with that being said, thank you guys. And I hope you have a good rest of the day and, get some rest. It's good for your mental health. Bye.